A patient burned herself by touching a hot pan and ended up getting second-degree burn. Second-degree burn. A patient noticed something odd on her lips and went to the doctor and was diagnosed with impetigo. Impetigo. A mother brought her child to the emergency room due to the fact that she had rashes all over her body and found out she was diagnosed with eczema. Eczema. Dermatology is a type of medicine that a dermatologist gives you when you have skin or hair problems. Dermatology. An old woman was diagnosed with purpura because her blood vessels were fragile to everything she hit. Purpura. Your humerus and femur are considered your long bones. Long bones. Your ulna, radius, and metacarpus are part of the upper extremity of your body. Upper extremity. A patient fell down the stairs and fractured her tibia. In this case, it is called a closed fracture. Closed fracture. A patient was riding a four-wheeler and ended up flipping over a big hill and completely broke his arm in half. This type of fracture is called a transverse fracture. Transverse fracture. A patient's back has a lateral curve to her spine and was diagnosed with scoliosis. Scoliosis. A patient was developing thrombus when he came into the emergency room. Thrombus. A patient was having a cardiac arrest while he was out to dinner with his wife. Cardiac arrest. While a patient was getting their blood pressure taken, his blood pressure was above normal. This is called hypertension. Hypertension. A patient has obstruction of one or more cornea artery attached to their heart and was later diagnosed with coronary artery disease. Coronary artery disease. A patient was starting to have inflammation in their vessels and was developing anginitis. Anginitis.